My dad is the hardest working man I've ever known.
We had an amazing childhood growing up. We never went without anything.
Garry has been a tremendous provider for our family.
I was raised by a single mom, and my mom instilled the value of hard work to survive.
My dad worked out of town, but he'd still show up at the Little League games. He was still there for the right moments.
Family is above and beyond the most important thing in my life. Last year, I had an infection in my toe.
We were keeping an eye on it, but the infection escalated, it seemed like. And one day, he just wasn't himself.
He wasn't getting his words out. He couldn't say what was wrong with him. So we knew right away that we needed to call 911.
When I first met Garry, he was mostly bedridden. I could tell from his appearance that he was in a state of sepsis. The infection in his blood had already seeded his mitral valve, and he had developed a vegetation or a growth on the valve, which had flickered and caused 11 small strokes. And there was still one 2.5 centimeter piece that could go to the brain. That's a life-threatening situation.
I don't think 2 minutes went by where one of us was not by his side in the hospital.
We were his rock at that time when he needed it.
The infection has caused the growth. There was no way of saving this valve. It needed to be replaced. I explained to Garry's wife and daughter that if his anatomy was appropriate, we would be able to achieve the operation through the right chest in a minimally invasive fashion.
After discussing that with Dr. Mario, that made us feel a lot better.
We knew that he would make the best decision for Dad.
So for Garry, I had chosen a bovine valve from Edwards Lifesciences. I've trusted Edwards for over a decade, and the MITRIS valve with Resilia tissue has been designed with anti-calcification treatments that will potentially allow the valve to last longer. For Garry, at 66 years old, in a precarious medical condition, that sealed the deal. The operation went great.
We were very lucky that he was able to use the minimally invasive option.
We were able to replace the valve, and the valve functioned very well.
The day that Dad was going to be released from the hospital, there was a huge parade in front of the house. It was overwhelming how happy everybody was to see Dad come home.
I knew how many people actually love me. My recovery since I left the hospital has been a series of stages, the wheelchair and then progressing to a walker, cardiac rehab at the hospital.
Fast forward to about 3 to 4 months after his operation, and I see this man pass me by. I do a second take, I see it's Garry, and I had never thought he would look so good. That makes it all worthwhile. It really does.
I'm retired now, and I got plenty of stuff to keep me busy.
I've added him to the drop-off and pickup list with the grandkids. He is now our grocery shopper.
Seeing him enjoy his retirement, it's just amazing.
I think we're seeing a new version of him. My kids get to live this great life with their pops because he's still here.
I'm grateful for the opportunity to spend many more years with my wife, my kids, and my grandkids.
We're just so blessed that we have our dad back.